Not every police department in this country has body cameras because of the cost.
But Governor Mike DeWine says he doesn't want that to stop Ohio from making the necessary changes to its police forces. The governor making those comments Sunday morning on Face the Nation.
DeWine discussing a pathway to police reform in the state, and this comes as part of the state has seen increased pressure from protesters calling for de-escalation tactics, transparency, and reform. It comes after protesters lined the streets outside the Ohio State House Saturday in response to the police shooting of Ma'Khia Bryant. Police body camera video showed the 16-year-old with a knife in her hand. The governor says there is a bill in the State House right now that will address some of these issues.
We have a bill in front of the state legislature that we presented, for example, that calls for a lot more police training, more uniform police training. We have 900 and some police departments in Ohio. Many states have a lot of small departments. Many times because of resources, they don't get the training that they need.
DeWine adds that they also are looking to improve funding for more body cameras for police departments across the state. And starting today, several law enforcement agencies across Summit County, they will meet for crisis intervention team training. It teaches law enforcement how to respond to a person dealing with mental health issues.
News 5's Meg Shaw joins us now live to explain what this involves and why it's so important right now. Good morning, Meg.
Hey, good morning to you, Mike and Danita. Well, mental illnesses and drug and alcohol disorders can be very common in adults. National stats show that 1 in 5 adults will experience one of these issues at some point in their life. But here's the thing, a lot of people don't get the help that they need because of stigma. So then when they do call for help, it's often at the last minute in a dire situation. So now law enforcement in Summit County are training to be prepared for those last-minute calls.
The pandemic has certainly taken a toll on mental health this past year.
I think there's a lot more depression, anxiety, even the paranoia, things like that. So if you've already got any of those issues going on, it's even worse right now.
It's leading to an increase in calls for help across the country. Data shows about a quarter of violent law enforcement encounters involve someone with a serious mental illness.
Law enforcement is not trying to arrest people for that. They really have worked with us very collaboratively. They want to see these individuals get help.
Many mental health professionals believe conflicts can be avoided if police have crisis intervention training, or known as CIT training. It includes recognizing and identifying the signs of various mental health issues, knowing how to de-escalate a situation, and most importantly, learning about what local resources are available to get the person the right kind of help.
If we know what kind of options people have, then we're better equipped to give them help, and also to say, hey, it's not like you just have to go to the hospital. There's other things we can do for you. And a lot of times if that required them going to the hospital for an evaluation, then we really would never see them or have any interaction with them until they're in crisis again.
Part of the crisis team includes a counselor or social worker. They ride with officers doing weekly case follow-ups to connect people with resources, schedule appointments, or even take them to their appointments.
You know, a lot of times people just want to be listened to and heard, even if they're paranoid or depressed. And, you know, sometimes people just don't know where to get the help.
CIT training isn't just for officers, though. Those who work in hospitals, medical facilities, or even firefighters can join in. Part of the CIT training expansion project includes data collection, so mental health agencies can record how many cases law enforcement are responding to.
Then resources can be allocated and funneled towards what those crises that we're seeing out there, and we can hopefully better serve people in the community.
All right, so CIT training will continue this week in Akron. Now, police want to remind you, if you or a loved one are experiencing a crisis and you're calling 911 for help, and it may involve a mental illness, you can request a CIT officer. If you tell the dispatchers across Northeast Ohio know what that means, and they can get the appropriate people to help you in whatever situation you're experiencing. Reporting live, I'm Meg Shaw, News 5.
Getting the help is crucial. Thank you so much, Meg. And more information now, if you or someone you know needs mental health help, here are a few resources on your screen right now. You can reach the National Suicide Hotline 24 hours a day by calling 1-800-273-TALK or 8255. It's the same with calling Summit County's ADM services. You can also text the number 4 and the word HOPE to 741-741 for free support. We have these resources and more posted on our News 5 app.